All right, we're live. Welcome and thank you for joining us today as we discuss Don't You Forget About Me, understanding more about the role of Gen X in healthcare. My name is Nick Perval. I'm the business head for healthcare here at Lead Squared. I have worked for over a decade in software technology sales, and specifically for North America. And I've been with Lead Square for almost 2 years now. Today, we'd also like to learn, a little bit about our audience. So, feel free to introduce yourself. Tell us what organization you work with, what's your role. We'd love to learn a little bit about you as well. And joining me today are two of the brightest minds in marketing and healthcare. I'll turn it over to Alan to introduce himself.
Thank you. I appreciate that introduction. Alan Schubert, I'm the Associate Vice President of National Communication for Providence. We're basically a West Coast health system, over 50 hospitals and 100,000 employees.
Dean, you want to go next?
Absolutely. Thank you. So my name is Dean Brow. I'm the Chief Behavioral Officer for Feedback. We are a market research firm, but specifically in applying ethnography in an online space. So think social listening, using behavioral science into how patients, consumers, as well as employees are talking online.
Great. To quickly review a few housekeeping items before we get started, to avoid distractions or any background noise, we'll mute all attendees for the time being. So you don't really need to worry about any kind of background noises on your side if you're working from home. If you're having issues with the volume, try clicking on the setting wheel to either change your audio device or to adjust the volume. We encourage your participation and engagement, and we'll have all about 4 polls throughout the session today. So feel free to provide additional commentary in the chat as well. We're hoping to pique your interest and conjure some ideas. So there will be time for Q&A at the end of the webinar. Please use the chat function to ask your question, and we will get to them as many as we can. We will also follow up after the webinar. So don't worry if we are not able to get to your question during the next 60 minutes. With that being said, let's get started. I'll turn it over to Alan and Dean.
Awesome. Thank you. So here's what we're going to go over today, just to give you a sense of what we'll cover. First off, about Gen X in general and why you should care, talking about them specifically in healthcare, and then into some core needs, some core characteristics that they exhibit, as well as then how to effectively market directly to Gen X. And as a part of that, we'll also maybe even talk about why generations aren't even the right way to think about things. But we'll also get to that as we go. First, we want to open it up with a poll, though, and find out, what generation are you? We'd love for you to go ahead and answer the poll here as it goes up, and let us know, are you silent generation, baby boomers, Gen X, millennial, or Gen Y, Gen Z, or iGen, and it has many names. But which one of these that you fall into?
And we're not allowing any of the in-betweens, like the Zennials or the Generation Jones. No, you have to choose. You have to make a choice.
Yeah, I mean, just use your birth year. Like you can't fudge that. So you can. Looks like we're getting a lot. The Gen X and millennial, probably no surprise, given the audience right now is coming through. I like the Gen Z in my heart, but Gen X in truth. That's very much we see that. We see you. All right, so continue to answer in the poll here, and we'll go ahead and get kicked off with, who Gen X is and why should you care? And honestly, I always find if my background is not enough of an example of why I'm just a Gen X man-child, I actually am a great example of the weird world that we live in from a generational perspective. So I'm Gen X. I am married to a millennial. I have an 18-year-old daughter who's in college now, who is Gen Z. But then I also have an almost 3-year-old and a 1-year-old who are to be in a generation to be named later. So in our household, one household, we have 4 generations, and a grandparent isn't even involved. So it just goes to show you, I mean, that you know, we're all interacting with all different generations at all times. But let's talk a little bit about Gen X specifically. This is why Alan and I are here. This is why we wrote a book. This is why it's incredibly important to look more carefully at how we talk about Generation X. And that is, you'll notice what's not on the screen. This is an actual screenshot from a CBS News story that somehow managed to leave out an entire generation, Generation X, which would normally obviously be wedged here in between the boomers and the millennials. And this is exactly why we do what we do. I mean, there are thousands of books written about baby boomers and thousands of books written about millennials, and yet very, very few written about Generation X. It's part of the reason why Alan and I decided to write the book on Gen X in healthcare, but this screenshot really says it all for us. So, you know, as you saw in the poll, where is Gen X in this mix? I mean, I know it can hurt sometimes to see the age ranges here. Although, honestly, I think the people that it ends up hurting the most are millennials who are struggling with the fact that they're turning 40. And the fact that there are millennials who are turning 40 is always kind of an interesting thing to point out to people who love to call anyone under the age of 40 millennial. But, you know, you could see how this starts to break down. And, you know, again, with Generation Alpha, we're actually not sure where we're going to put this cutoff. And in fact, actually, the cutoffs are a little arbitrary to begin with. You could see it gets to be like roughly about 15 years. It isn't, it's not really a hard and fast rule per se, but we'll be interested to see where that cutoff with Gen Z and Gen Alpha ends up being. So let's talk about us. Now, first off, the reason why we don't get a lot of books is, at least arguably, is because we don't have the numbers that boomers and millennials have from just a sheer population standpoint. But it's not as if we're completely non-existent. And so I think it's worth really looking at the numbers in the greater detail, because what we often don't realize and think about is that actually generations grow. Yes, you can add Gen Xers to a group. And the way you do that, especially from a national perspective, is through immigration. Of course, the other way that you can subtract is, well, old age, death, and things like that we won't talk about. The more morbid ways that boomers will also decrease in terms of size of population. But what's interesting about that is the fact that in only a few short years, Generation X will actually outnumber the boomers. So this like push and pull on numbers is always a little bit disingenuous from the standpoint of paying attention means that millennials, for example, are already going to be over the boomers in terms of sheer population. So let's talk about the economic impact of Gen X, because I think that's something that really helps put our generation in perspective in terms of where we're at. First off, a higher percentage of college degrees, as well as then, and you can even see how that's strikingly actually even more than millennials. The majority of startup founders are Gen X. With 31% of the total U.S. income, which again is a little interesting from the standpoint of the fact that we're kind of in the middle, between two of these large generations. You can see the average income there, but we're in the worst financial context. We have the highest average, highest average in debt, even above millennials. And actually, even before you consider mortgages. So a lot of that is both from a student loan perspective, credit card debt, other things like that. Therefore, our credit score then is, of course, also worse than boomers. And yet, with all of that, we still outspend all of the other generations in housing, clothing, eating out, and entertainment. So we are consumers with a capital C from a generational perspective and manage to outspend our, either sides of our cohort here from a generational perspective. And that's despite being in actually even more debt with a worse credit score. So let's kind of keep up with a little bit of sort of 30,000 foot view of Gen X. We're also the most likely to be married. 71% of us have kids, as I'm also a fantastic example of. Even those of us who have kids have them in multiple generations, in fact, potentially. We also are the most likely generation to have a higher household income from the standpoint of being over 100K, from a likely standpoint. But I think these quotes probably really embody what we hear from a lot in Gen X, or sort of that saving for the future not being a luxury that you can afford, and just truly worrying about what is being over 65 going to mean financially for this generation. And I think that this really this really starts to set the stage for Gen X, because even though we're in the Pew studies love to use this term, the middle innings of life, every generation is going to go through what Gen X is going through right now, right? I mean, when millennials get old enough, they're going to be in that middle inning. They're going to be in that middle stage. The boomers have been in this middle stage. The difference is, what are we going to be like when we're in it? And that's where you have an opportunity with Gen X to get to know them, because they are such incredible targets for you, both from a healthcare perspective and beyond. Also, just as we're not going to go too deeply into this today, but it's also worth noting from a workforce perspective and from a leadership perspective in workforce, Gen X is absolutely a big sort of mover and shaker in that, and another reason why we really need to pay attention to them. So let's get to a little bit of a poll here. From a workforce perspective, what gen is the majority of your workforce? Now, I know that could be a broad way of thinking about it from the standpoint of, how are you talking about your entire facility or the hospital system, wherever you happen to be working. But let's even just narrow this and just sort of say your team and the teams that you work with most frequently. What generation is that? And I'm seeing a lot of millennial. I think that's pretty common. But just how this typically breaks down, because I think one of the things that you'll get from this presentation is how you as a Gen Xer can be a little more self-aware of your generational traits and your perspective, where you're coming from, as well as then from the millennials in the room, and just from other generations in general, how you might be able to understand the perspective of Gen Xers and sort of where they're coming from, and how that can really help you from a workforce perspective. So keep voting on that, and we'll get back to this, and you'll see how this starts to work into what we're presenting. So, answering the question, my IQ is in the top 10%. Millennials just edge out Gen X in agreeing with that statement. This also is a great setup from the standpoint of how much Generation X and millennials truly have in common. Now, we have so much in common that people love to make up these bridge generational aspects, like Zennials, or from a Gen Z standpoint, or even from a Gen X standpoint, this idea that, well, I embody both and whatnot. And that's absolutely possible and likely, right? I mean, the idea that you are a completely different person from the person who's just 1 year older or younger than you is absurd, right? We all have these shared experiences. But it also kind of goes to show a little bit of the mindset of Generation X is actually very similar to the mindset of millennials. And I think that's actually a real advantage. I think it's definitely an advantage from a workplace standpoint, but it's also an advantage from a perspective standpoint, from a targeting standpoint of Gen X. As I mentioned before, Pew loves to use these kind of platitudes that, I mean, if you look at them too hard, you might consider them just meaningless, but they love to critique Gen X as being the middle innings of life, short on drama and scant of theme. Well, that's pretty cruel, I think, because again, everyone will be in the middle at some point. But Generation X also gets knocked as if we are sort of this personalityless generation. And what's really funny, of course, is that we got knocked very early on by being called slackers. And now nobody calls us slackers anymore, because we're in charge in many cases from a leadership perspective. But we get sort of dubbed as this, we don't really have a dramatic or dynamic theme to us in the same ways that millennials have or boomers have, which again, I think is more of a function of the fact that nobody stares at us in the same way that they stare at millennials and boomers from a sheer numbers standpoint. So this is what we mean by those middle innings, right? It's really where you end up from age 40 onward. That really sets the trajectory of when you're spending on health, and so you start to see how everyone ends up hitting this at some point, but it really starts to set the tone, which again, remember, millennials are now 40. And so they're now sort of in this boat with Generation X, and including, of course, young Gen Xers are just slightly older than millennials, and are hitting this boat though in this sweet spot of lifetime health spending that really begins from here on out. And so, this is true from a personal standpoint. What this doesn't necessarily show is you making the decisions for children or caregiving for older adults too, which we'll get to from a Gen X perspective in a moment. But you start to see, I mean, that everyone's going to be in these middle innings, but it really starts to show you why Generation X is really important right now from a focus perspective. And of course, that means for us, especially Gen X, life is creeping up. I mean, as I can certainly say myself, I am about to turn 46. I feel like the warranty has run out on my body. And I feel like everything has begun to fall apart in this last couple of years. And this is really netted out in some of the data here. And I should point out, much of these graphs that you're seeing here was data that was done by SPM, who helped us publish the book. And so there's some great polls that they've done from some nationwide data on generations here. And so it's really interesting, though, to see, obviously, boomers are ahead of us, right? In arthritis, blood pressure, cholesterol, diabetes. But you can see that we're getting there, and so are millennials right behind us. So again, you can really see how age, starts to creep up on everyone statistically. But now I'm going to hand it off to Alan, who's going to really help elucidate even more from this healthcare perspective in Gen X.
Thanks, Dean. And I just want to welcome all the millennials over 40 to the club on the chart that you just saw. So the journey only gets more interesting from here. But, my interest on this topic, in addition to being a member of Gen X and, always kind of bristling at the fact that we're left out of the conversations, my interest started too with thinking about who is the target market for healthcare? Like, who is our consumer? Who is our customer? And I've had a lot of conversations over the years where I'll be talking with an executive or someone, and they'll bring up something like, well, my teenager has no interest in going to the doctor. And you think about it for a second and go, no teenager wants to go to the doctor, never. And as the chart showed a few slides back, you just don't, for most people, thankfully, you just don't need to, unless unfortunately, you do have a serious illness or issue that's unplanned, and that does happen, but it's the minority. So people are not thinking about healthcare when they're young, and thank goodness they don't have to. But everyone will age into this journey. And so you have to look at a point in time, who is the target market? And every generation, Gen Alpha is going to be where we are as Gen X sometime. Millennials are coming into it. But, we really are making a case, Dean and I, that, for right now, the life stage that Gen X is in, they are the target market. I'm going to talk about this concept of healthcare triple threat. But first, I want to share this quote. I think it's just a good one to provide some insight and some context, about what sort of shaped the Gen X experience. So as Dean said, not everyone in Gen X is exactly the same, but they shared the same experiences. So they shared a conversation about healthcare that really matured from what the boomers and others had talked about. So I thought this was really great. Gen Xers were the first to grow up in an era of internet available health information. They also grew up with direct-to-consumer advertising, prescription drugs, and consumer activism in healthcare. They witnessed firsthand the AIDS crisis and the dawn of health advocacy. As a result, they bring a less passive and more discerning attitude toward health than the generations that preceded them. And I think that really that experience is shaping, how we consume healthcare, how we think about healthcare, just our comfort level with talking about things. And, this trend that started with our generation is definitely picking up with the others. So just helpful context to think about that shared life experience. And this idea of the triple threat, there's three areas where Gen X really kind of hits the mark as that main consumer and what we're experiencing right now. So for many of us, we're being caregivers for our parents, maybe not always directly and, providing everything, but our parents are aging, they're needing more help, and we're stepping up to take that role on. So we're making healthcare decisions. We're deciding where they need to go. We're deciding, how they continue with their doctors. We're probably getting them on Medicare Advantage. We're helping out with a lot of that. So we're in that caregiver role. And we're also becoming patients more frequently ourselves, like Dean said. And, I use the analogy that, when you turn 40, it's kind of like owning a luxury German car. That check engine light comes on about every 3 to 6 months. And often it's nothing major, but you got to go in, you got to get checked out. Something doesn't feel right. And you're just in that cycle of needing care more often. And again, going back to what I was talking about with younger generations, a lot of times people will say, "Oh, younger people, they don't want a relationship," and that's not always true. But I think I would put it is they don't need one in the same way. And so as you start managing more complex care decisions, you're really going to balance. There's a side of you that really, again, wants the convenience and accessibility, and those things are very important. But a relationship also becomes important because you don't want to have to go explain your conditions to the doctor every time you come in. You don't want to have to make a lot of changes. So I think systems that can provide a blend of convenience and consumer-friendly um, attributes will have a chance to really have that relationship be solidified, and we'll share a little bit of data on that coming up. The third kind of leg of this stool really is that we're making decisions for our kids. Like Dean said, he's got a daughter who's in college. He's got two others that are younger than, and especially younger ones. They're not making any decisions for themselves. Every decision is being made by Dean and his wife, and that's a role he's going to play for the next 20 years. And again, so these areas are something where when you want to think about who is the target market for healthcare right now, it is this generation. And again, millennials are coming into this. Gen Z will be here. Gen Alpha will be here someday. But if you think about your most immediate needs, it's really good to understand this lens. Just going through kind of some of Gen X's attitudes to healthcare, we're going to go through some of that, but I think you also have to talk about anything with healthcare in the context of what happened with COVID. So the one thing about Gen X is there's a lot of stereotypes about us, and some of them are actually more on the positive side. And from our research, we did see that kind of they lived up to this. So being responsive, responsible, understanding, hunkering down and dealing with stuff. There were so many funny things on social media about, hey, Gen X is good with being locked inside the house and not seeing others. That's how we spent our childhoods, and just figuring it out on our own. And so, you did see a lot of stories about people who, Gen Xers who were kind of making sure their parents got their boosters, making sure they got their vaccines, making sure they were safe, and doing the same thing with their kids and taking on that responsibility. And I know I just had a conversation with my mom the other day. She was asking me, well, what do you think? Should I get the next booster? And so I'm counseling her through that. And we're just had that opportunity to really kind of lean into the things that we are known for, and I think we lived up to it during COVID. This is some other data as we were talking about as we put together for the book. So just how does Gen X approach healthcare? What are their attitudes to it? We do have a sense of worry, again, getting older, having things starting to happen. I think if you look at this data, it's the boomers have kind of, a lot of them have sort of figured it out. They've been dealing with these things for a while. They've got their care coordinated. Again, they know that, more serious things could happen, but they've really kind of eased into understanding their healthcare needs and their physical challenges. Whereas, we're in the midst of dealing with that. Millennials are creeping up, but this audience is really interested in, what can I do to take care of myself the most? So how can I prepare? And I think you'll see that targeting this audience and trying to reach them, you're going to find a receptive audience that's thinking about healthcare in an active way all the time. Also, just thinking of how likely are they to get care? I mean, there is a little bit of a barrier here in thinking about it. So we know in, thinking about terms of marketing and healthcare in general, there's a lot of procedures and things that just, you don't make a choice. If you have, unfortunately, if you have a heart attack or some serious incident, you're not going to make a choice in your care. But there are parts of healthcare where you can make a choice. So, looking at orthopedics, that's been one traditionally where a lot of healthcare marketers have seen some opportunity and really going direct to consumer and trying to convince people that, that pain you've been having for the last year or two, like, go get it assessed and think about having it addressed. Well, Gen X is aging into that, and they are making those types of decisions, but they're, a little more reluctant. They're going to hold out. You're going to have to kind of do some work to nurture them and convince them about why they should take some action. So I'm going to turn it to Dean for even more on this. So this is one of my favorite parts of the discussion, because I describe myself as skeptical and cynical, but Dean's got a more nuanced take.
But just barely more nuanced. So what you're already seeing, I think, even in some of the survey data that Alan was just showing, is this idea of wanting to kind of go our own way a little bit. And I think that what we see is that we have these core characteristics that are based on informing ourselves. And this really takes a few different forms. Number one is just being hungry for information. I mean, that we do our homework. I often say in other discussions and talks on more of my research side, I know your website's going to say nice things about you. You created it. I want to know, what does someone else say about you? I mean, think about our entire sort of psychological approach to buying on Amazon and looking at reviews and how many reviews something has, not just whether it's positive or negative, but this idea of being hungry for information before we make a decision. Are these exclusive to Generation X? Absolutely not. But I'd say Generation X really took the ball and ran with it as we aged to really want these three things. Number two, then, is being skeptical of experts. That doesn't mean we won't believe experts ultimately, but what we need is evidence that you are an expert. Now, this is often, I think, us just being allergic to people telling us, oh, I am an expert, which of course it's like a little bit of that. I'm think of it as like a sitcom joke, like, well, if you have to say it, you might not be one. But this idea of like, I'm just going to automatically think of you as an expert and think of you as a source of information and influence, but rather I need to see the proof in the pudding of exactly how you operate, decisions that you're making, whatever. This can also be in terms of even how we read reviews, right? I mean, somebody that doesn't write anything to a review and it's just a star rating, or somebody who even just gives a very pithy review versus something that's much more detailed, we're going to believe the more detailed one. I want to see the evidence that you know what you're talking about. But for all of these things, for all of being hungry for information and being so skeptical, it doesn't mean we can't be loyal. In fact, the trick is they are very loyal. They become loyal. They convert to loyalty. They don't just give it freely. They don't run and rush in and are loyal even after, in some cases, the first transaction. But the trick is that once they've made a plan of action that is based on the information they've collected, they feel comfortable with it, they feel comfortable with the experts whose advice they're following, and they have sort of a lane to be in, they will be loyal to both that plan of action and ultimately potentially that brand that helped provide them with that product or service at the end. In fact, actually, once they are loyal, they're very hard to shake off. I mean, it really would take something much bigger to get them to sort of detach that loyalty. So the good news is it can still be intensely loyal. Just to get there, they've got to go through that process, and you've got to understand that they're beginning from that point of view of being a little more skeptical. We value relationships with those that we trust. And again, that trust is going to be hard earned, but it's going to be earned. And so I think that's the thing to always keep in mind with Generation X. Honestly, this is as much a consumer and brand perspective as it is. Think about it in terms of the workforce as well. I mean, you earn my trust, and man, I'll always back you up. The trick is you just got to bother to do it. Don't just make an assumption that I automatically trust you right out of the gate. Part of that's from being burned, right? I mean, as a generation, whether that's from, upward, from an older generation and promises that were made and what we actually ended up into. And some of it is, of course, the fact that we, when we finally get control of the car, we're going to be more careful with it, to use kind of a metaphor for life and possibly the earth when it comes to Generation X and our perspective there. We take rebellion to a whole new level. I mean, look at the fact that we actually somehow managed to really leap over boomers from the standpoint of being skeptical about what doctors say. Part of that is not because we don't believe a degree a doctor has, but it's about everything from do I trust the nature of which the treatment plan, and that it's really in my best interest, not just the best interest of, say, the doc or what even the health system or the hospital has in mind. It could even be about from the standpoint of, does this doc have experience with the specific thing that I'm battling with? Maybe I need a second opinion. I mean, Gen X are kind of the kings and queens of second opinion when it comes to healthcare. In fact, if you're asking us if we know my health better than the doctor, again, we leap ahead when it comes to this, even though silent and boomers barely moved between the two of them. So now, does this mean I have a medical degree just as my doctor does? No, but there's a big nuance here that's really important to understand. And I think it actually has trickled down to millennials in many cases too, which is I know my health in the sense of I may only get 10 minutes with this doctor, and trying to convey everything I know about my health and my body, particularly in these middle innings of life, I'm sitting there trying to convey everything I've been through in order to get advice on a singular thing. So the idea that I know my health isn't necessarily just an arrogance on Gen X's part. It's, again, building off of this hunger for information, the fact that, they've likely been in forums and message boards for a particular condition for a while, and they've been learning about it. They come, loaded to bear. And if it was a few years ago, they might have even brought out printouts before they decided that was an environmentally unfriendly thing to drag to the doctor's office. So don't just take this from an arrogance perspective, but it is, again, from that perspective of being skeptical and being very informed, both on what they're going through and also just knowing their body. So to that same point, I went online and self-diagnosed myself instead of visiting a physician. This has much to do, I think, also with the cost of healthcare and the idea of, look, if I could figure out what's going on with me, that's an entire copay and much, much more that I may be able to avoid, especially on the lower priority kind of aspects and issues too, and diagnoses. But the idea that I'm going to go in and self-diagnose, it doesn't mean that I won't go to a physician ultimately, but in this case, it's literally making that decision to not go to a physician right now based on having a sense of what it is that I'm going through. And as Alan says in the chat, some people might still bring out printouts to the office. In fact, my dad, I know, still does from a boomer perspective. But the same time, even though I know we've been going through it, just to go back again, look at this, look at these about, I know better than my doctor. I know my health better than my doctor. I'm going to self-diagnose instead of visiting a physician. And yet I would change my insurance to keep my doctor, the one that I trust. Look at the fact that we just edge out millennials, but in fact, across the board, including Gen Z. First off, I want to know what Gen Z answered this poll when it was likely given to them in terms of even having picked their doctor. But the idea of rewarding that loyalty of the doctor who you trust for the issues that you go to them, I think for the Generation X, the other thing we should make sure to underline here is this could also refer to specialists, right, for the specific things that they have been battling and that they have gotten to know about their body and the issues that they're going through, whether that's blood pressure or whatever the case may be. This idea of I would change my entire model for paying for healthcare in order to keep the doctor that does understand me, that has won my loyalty and my trust. I think this is incredibly powerful and a really big point here. So I want to keep on going with this next section because I think this is really important to basically kind of use as a bit of a record scratch moment on this entire conversation about Generation X and just generations in general. First off, we are not the only generation to start out with a bad rap. Remember, for us, it was slackers, we're cynical, the whole 9 yards. We're not the only ones. A lot of other generations have gone through that same thing, just with a different angle. And just because a generation is written about a lot doesn't mean that those characterizations are fair. In fact, my favorite soapbox to get on in Generation X for generations is Strauss and Howe's Millennials Rising. Now, Strauss and Howe, I should point out, have written many great books about generations. Millennials Rising is not one of them. And there's two big reasons for that. Number one, as a book itself, it focuses quite a bit on interviews and polls done with kids in Northern Virginia who were about to matriculate from college, who were millennials at the time. Now, first off, if you've ever been in Northern Virginia, I live in Richmond, Virginia. I've lived in Virginia most of my life. That is not the bellwether for what the entire nation should be, from using that as your benchmark. But number two, here's the other problem. This book was published a month before September 11th. And that book is on the shelves of many a principal at the time, president of colleges, and I've seen it, and then beyond into the corporate world about how to deal with millennials. And yet here's an entire book that one of the premises is that millennials had never been through a national tragedy. And it was published right before September 11th. So my whole point of bringing this up is we wrote a lot about millennials before millennials were even in the workforce, before they even had disposable income to be able to spend on things. And yeah, to Alan's point, it's also about 1,000 pages long. And yet all of that is from a perspective that immediately changed at the very next month. And so point being, we write a lot about generations without giving them the chance of actually acting in their own interests and being able to understand what they're actually going to be like in real life. We can get trapped in outdated thinking by using generations. So this is why we actually suggest that generations may not be the route to segment by. In fact, we would say life stages are the way to do it. Let me give you an example. We tend to focus generational differences down life stage. In other words, we look at where we are personally and we look down. So now I look down and I also have young kids, but if I didn't have those young kids, I might look down and say, okay, everyone with a young kid right now is a different generation. So I sort of like look down in that way and maybe pejoratively talk about this. We've seen this at every holiday. I don't care if you're at Thanksgiving and your uncle like makes some crack about millennials and what they being on their phones all the time. And what he really means is anyone under the age of 40, right? People use these terms to just sort of blanket, giant swaths of the population. But what we often don't think about is the up life stage parts of generations. For example, those 40-year-old millennials who are about to buy readers because they need reading glasses to even see the menus at the restaurants before they take photos of their food on Instagram. Just kidding, millennials. But the other point here is that the oldest millennials could actually have 2 kids who are in college right now, right? So they behaviorally may have a lot more in common with Generation X. So I think that's where this is really important. Again, we tend to make up these little bridge generations like Zennials or whatever you want to call it. But what it really means is the generations aren't great ways to segment people. So maybe the way to actually segment, maybe the way to actually segment then is life stage. So in other words, think about it in terms of both what they need from a age standpoint, again, whether you're talking about those particular medical conditions that come to pass up at a certain age of their lives. Maybe it's about kids, right? When I look at reviews of car seats, I'm probably not necessarily reading reviews by other Gen Xers. I'm looking at the reviews likely left by millennial parents. But the life stage that I'm in helps to really frame me in terms of what my kids need in terms of healthcare. So if we look at life stage, first home buying experience, just moved into the area and young with 1 kid, look at it from a life stage perspective, it saves us from tripwires and from a generational differences standpoint that we might hit otherwise. So now, how should you actually market to Gen X? This is where Alan will take it.
Thanks, Dean. Yeah, and I thought that last slide, I just love the fact too that you have to think about how different is someone at age 26 and age 40, right? I mean, it's very different experiences of things they're going through. But as the generation gets a little older, I think the differences become less. And I think so. Looking at Gen X, you can check at the whole generation, and they really are having those shared experiences, like we talked about, especially within healthcare. We have a poll. All right. So for anyone who is kind of in the marketing space, what is your target market right now? What generation do you market to the most? So I'll let that take a second. All right. Okay. Gen X, baby boomers, and millennials kind of split. Okay, that makes sense. Great. Thank you for the insight. And if you didn't vote, go ahead and do it. So, not going to give like a whole, every tactic you should use, but we're going to just walk through some high level concepts and just some thinking. So I also want to reiterate too that, for most of us, especially if we work at large organization or even if we're more on the agency side, it's unlikely that Gen X is going to be the only audience you're targeting or thinking about or communicating with. But you should recognize that it's the core audience, and it's the audience with the highest likelihood to make those decisions. So as you're putting together your creative and your messaging, there's ways to just respect that and think about that. And some of us, I realize too, do have the ability to get more targeted and do have the ability to take some of their creative and do it differently by audience. And if you have the ability to target down there and think about that, that's where you can get into those benefits. Like Dean was saying, what does a 35-year-old who is active in healthcare want versus a 55-year-old? It's very different. So if you're kind of marketing services, you might want to think about which services are going to which people. How do you kind of drill down if it's more general? So there's a lot of options there, but I just think always keep in mind that that core audience is going to be the Gen X audience for healthcare right now. So can you message to them in ways that still speak to millennials and boomers on the edges of the audience? Yeah, I think you can. And just where if you have to make decisions about how to structure the message, think about what Dean was walking you through, and we'll go through some of those in a minute too, just about what matters most to the audience. And I mentioned a second ago, but where you can target more precisely on generation and life stage, I think that is the opportunity to lean into that. Things like direct mail, email, digital, there's ways that you can be highly more targeted, serve up very relevant messages for that life stage, and use some of what you understand about what type of messaging works with the generation to drill out it even more. So I realize, again, some of us have capability to do that very sophisticated way. Others are kind of just getting into it. But this is a great way to just kind of frame your overall approach to doing it. And what messaging does work, and Dean hit a few of these before, but things like peer endorsement, not making wild claims that you can't back up, just saying, hey, we're the best. This audience is going to take a look at that and go, well, what do you mean? Like, measured by how? What are your supporting points? Just throwing out superlatives is not going to work very well. It's going to be a message that gets passed over pretty quickly. Kind of building on that point, but asking, information that's logical, that makes sense, that's simple, that's clear, that again, someone doesn't see and start questioning and going, wait, how'd you do that? Where did you get the facts for this? I mean, if you're going to cite something, make sure it's there, make sure people understand what you're doing. Transparency, just being, I think that level of like honesty and not overselling what you offer is really important. And can't hammer this enough, but just understanding that life stage, what people are going through, so that you're actually speaking to people in the right way. And that does carry over a lot to things like your creative and your messaging. So I think this is really important. And I use the example of Dean and I were doing this same talk a year or two ago, and the people who are helping us with it, they put out a promotion that included pictures of people who are not close to Gen X age. I mean, they were in their early 20s at most, and we were talking about reaching Gen Xers. And so, that immediately put my radar up, and I'm like, wait, this is supposed to be targeting people who want to have a conversation about Gen X, and they're showing the wrong generation. And it's not borderline cases, it's very clear. So, if you're going to try to target someone who's, in their mid 40s to, near 60, don't use a picture of a 25-year-old. I know that sounds very basic advice, but you'll be surprised by how often people forget it, because again, someone will see something, and if it doesn't hit that click in their mind right away, often they'll think that they're not the right audience, this isn't for me, or they don't understand me. And none of those things are good. And it's pretty easy to actually get around it by just making sure that what you're going to show reflects who you're trying to reach. Another one that's just really important to this audience, but all is, make it readable, make it easy to understand. I mean, that's should be a call to action for any generation. But again, with us, we value it. We really want to trust what you say, but we're going to verify it, and we want to know. So again, make it clear, make it easily understandable. I think also calls to action that allow for choice are really good. This audience, you'll see in a minute, responds to all types of different media. So you can't go wrong with trying to have a pretty broad approach. And again, kind of narrow down by your available budget and resources. But this audience does respond to a lot. It joked about QR codes. I thought they were dead during, before COVID. And then during COVID, they came back because every place you went now said, hey, scan our QR code to get information or get our menu or whatever. So that technology is advanced also in the fact that, you can use your phone and the camera, you don't have to have a separate app. So it's kind of a funny point. But again, those things that make it easy to get information from your phone, text, email. Gen X responds to all that. They're not digital natives. You'll hear that term. Like some people will say digital natives, like you're born in an environment where all you've known is digital. Well, Gen X is sort of in some of the older millennials, I mean, we're in that kind of both camps. We grew up analog and we embraced digital very early, and we're very comfortable with it. So again, you want to offer choices. I think that's the biggest key for this audience. Give them multiple ways to get in touch with you, and then make sure you deliver on it. Just a personal anecdote for me, I was needing to go in and see a specialist on a follow-up thing, and they had an online form. Make an appointment online. I was like, great, I want to do that. I don't want to have to pick up the phone. And I submitted the online form, never heard back. waited like a couple weeks, submitted again, never heard back. Well, finally, I had to pick up the phone and talk to them, and I'm willing to do that. And this audience is willing to do that, but it wasn't a great experience. And you do have to be careful too, as these audiences evolve. That a lot of our research shows, younger generations, if you give them an online option and don't fulfill it, you've probably lost the customer. With Gen X, you might be able to rescue it because they're going to take some additional effort, but make it easy and don't offer options that you can't deliver on from a contact perspective. I mentioned that what the audience in Gen X really trusts for information, it's pretty broad, but we've seen lots of studies that, again, hospital and health system websites, it is a trusted source for information. So they will go there, they will want to know about things. Again, using information that's clear, that's supported by evidence, peer endorsements, all that is very helpful to reinforcing what you offer, but that is a trusted source. Still, things like getting mail or newsletters, and this could be digital or print, but probably mostly leaning digital nowadays. But those from the trusted sources, getting it from their hospital health system, getting messages from things like Epic MyChart and others, those are highly trusted ways to reach out. Still see the audience responding to more traditional media like TV, newspapers, radio, print, and the digital things are there too. So I guess the biggest thing here is just that if you have the ability to build a campaign that has multiple media sources, you'll want to consider all these, and you'll want to think about, again, how you have some calls to action that can convert and make sure those are built into your campaign. But you're going to want to look at all these options and just figure out what's the best way to get people to you, but know that there's a lot of options with this audience. I do think people sometimes ask, is there a min spec? And I would say, if you're looking at something where you don't have necessarily a lot of budget, but you want to reach this Gen X audience, I would say email marketing is still really effective. We all say we hate email, and we all kind of do, but we all get it. We get it at work, we get it personally, and it will get to us. So again, think about how you can make it effective. Think about how you can have the right calls to action, but that is a cost-effective way to reach people. Same thing, on social, you do have to have some budget sometimes to boost posts and things like that. But again, Gen X is really active on social. They're likely to engage in conversations. They'll leave reviews. So if you're going to put stuff out there, expect to interact with this audience. It's always a pet peeve of mine when people put an offer or they try to solicit some information online and then they don't do any work on the follow-up conversations. People ask questions. There's no engagement. Big missed opportunity. But again, social media is a great way to target this audience. And if you have the option of kind of potentially having a bigger budget, you want to look at things on the traditional online side because, again, Gen X is definitely fully online, but is still watching plenty of traditional TV. So kind of our last session here, not to put any pressure on anyone that's Gen X, but can the generation save the world? And that's actually, as Dean mentioned, that there was only a few books written about Gen X, and one is kind of titled something along the lines of "Will Gen X Save the World?" or "How Gen X Can Save the World." I think that might be the title. There's only probably about 4 or 5 books on our generation written, including ours. But it is in the kind of time frame where Gen X is moving into some leadership roles, and we do have the ability to also kind of nurture the millennials and other generations, and we're doing that. So, kind of some interesting things to think about as we get wrapping up this conversation. But as we were thinking about the book and asking the question, what does the future look like for X, Y, and Z generations and the boomers too? And I think the biggest word to describe it is challenging. We have so many crises and things to think about around the world, and including healthcare too. Healthcare this has been, for anyone working in a healthcare system, this has been the most challenging year and the most challenging 3 years of probably the last 100 almost. And, how do we make sure that we can help think about the solution? So there's, like I said, no pressure, Gen X, but whatever you can do to think about making the world a better place, I think it's going to be an important role. And mentioning too the gateway to the millennial generation. So if you know about Gen X, I think you'll be prepared for a lot of what the millennials will bring. And again, we'll see how things develop with the younger ones, but we know people who are close to our age, we can help, and we can help be kind of the transition into, I think we would hope for maybe a more smoother transition than the boomers gave us into leadership in society, if I can say that. There are some, kind of similarities between the generations that we're seeing, and why there is some I think for that Millennial, Gen X, Gen Z transition, I think we're going to see some differences there. But we share some common attitudes about the world, and having some hope and optimism for something better. And that kind of might go against type, where we're talked about and labeled as cynical. But I think we're moving into a life stage where we do want to make sure what we're handing off to the next generations is as positive as we can help make it. Just a little bit more data on Gen X and what they do. So, again, highly online generation, and they like to reach people, chatting and texting. They're definitely active on that, and they're really close. I mean, Gen X is really close to millennials in terms of social interactions happening online. And I think that's another thing that we've seen with COVID. So many of the things we used to do solely in person, we now do online. And thinking of all the connections we make personally and professionally that, again, were more difficult in the past, now they're extremely easy. And we've really leaned into that opportunity. Also interested in health tech, so this audience is willing to embrace different things. And, again, we weren't born into a fully digital environment, but we got into it quickly and embraced it quickly. So things like interest in using a smart speaker at home, again, Gen X much higher than the boomers and pretty close to the millennials. Interested in using health-related apps, again, very close. So we're motivated to do that if you can deliver a good experience. Also thinking about health insurance question, and we've seen a lot of disruption in healthcare, and Amazon's just one that we pulled out and we're thinking about. But how would Gen X potentially respond to using a company like Amazon for health insurance or care delivery? And it's, again, much higher than the boomers and closer to the millennials than people might suspect. So again, when we can offer good relationships and solidify them, the other barriers to change are high. But if we can't do that, they will look for other areas to potentially build a relationship. And again, could someone like Amazon come in and make inroads with this audience? It's certainly possible. So I think it's why we want to think carefully about how we make sure and retain and engage this audience. And I have a couple of slides left, but Dean, I want to just make sure, did any of those last data points, anything you wanted to add to any of that?
No, I mean, I just think, just to reiterate, it is incredible how in sync we are with the millennials right now. And I think that will only continue. And that really does show the opportunity for us to save the world together. Because I think that, we know we may not get that same kind of adoption rate for things, or interest in innovation, or interested in just fixing the system from those older than us, but to know that sort of this current middle two is so in sync, I think is definitely something to be optimistic about.
Definitely. Yeah. Thank you. So just had a good quote that we included in the book, and I kind of pulled out for this one, but and part of it, I think this for us has been, really inspiring, I think, Gen X leaders to step up and take an active role in making things better and mentoring and doing all that. So we often have that call to action for ourselves. Let's step up and help. But this was a great series of quotes here. Future Gen Xers will preside over a world struggling with extreme wealth inequality, technological revolution, and environmental instability. But luckily, given their long history with sudden change and aversion to insecurity of any form, this generation will also be the best position to face these challenges head on and make a positive and stabilizing difference for future generations. So again, sounds like a lot, but I think we want to, as a generation, we want to do it. And the alternative is not something good. Like, we can't walk away from our responsibility. So I hope all my fellow Gen Xers listening to this will take that as a personal call to action. Dean, do you want to talk about the book?
Yeah, sure. So I put the link in the chat. If you're interested, both as in ebook or in print, you can get it from Amazon. But also, if you're into 80s music, there's also a mix tape, if you will, a playlist by the same name on both Spotify and Apple Music, actually, as well. But yeah, just we put this together out of frustration and hope over how Generation X is typically included, but I think really hopefully includes some great things for people to think about, no matter what your generation is. Because while it's about Gen X, it's also just really about looking hard at a generation and understanding that things are more nuanced than it often comes across. And so hopefully we give you some handholds on working both with consumers that you're maybe targeting from a healthcare perspective, as well as potentially even, working with teammates and on the workforce side.
And it's a lot easier to read than Millennials Rising. It's not 1,000 pages.
And it's actually accurate.
It's a lot more fun.
Yeah. So thank you, everybody.
Thank you so much. That's all the time we have today. But I do want to take a minute to thank both Alan and Dean for sharing their experience, their expertise, and about the book. Anybody who has questions, please feel free to reach out to us. We can connect with Alan and Dean and make sure that we can get you the answers for them. Also, we hope you can take some time to have the opportunity to offer, give us an opportunity to offer a glimpse into our sales and marketing automation platform. And until then, stay safe, be well, stay healthy, and we'll all connect soon. Thanks, everyone.
Right. Thank you.
Thanks. Bye-bye.
Thanks, everybody.